Good afternoon, everybody, and thank you for giving us an opportunity to share our work at Tech Cymru. I'm Alka Ahuja. I'm a consultant child and adolescent psychiatrist at Aneurin Bevan University Health Board and the National Clinical Lead for the Technology-Enabled Care Program. I'm doing this presentation along with my colleague Gemma Johns, who will introduce herself as well.
Gemma, I'm the research lead for Tech Cymru.
So just to give a bit of context about who we are and what we've been doing. So Technology-Enabled Care Program was tasked with implementing video consulting at the start of COVID, almost coming up to 2 years now in March 2020. If we remember, that was a time when there was a desperate need to continue delivering safe and timely care to patients and public in Wales. So it was an emergency response to the pandemic. We started out with implementing video consulting initially in primary care. So within a matter of weeks, we spread out to more than 90% of the GP practices so that patients could continue to get the support and care that they needed. Then moving into secondary and community care, care homes, dentistry, optometry, pharmacy, and now we're working with schools. While we were doing that, one thing that Gemma and I were very keen was to capture data from day one, because unfortunately with a lot of technology innovation initiatives, data is usually hindsight and there is very little evidence, although COVID has taught us that, when things are done properly, technology can support and facilitate a lot of healthcare delivery. So we've done more than 300,000 video consulting across Wales, and we have captured data from more than 52,000 patients and clinicians over the last 2 years. In terms of the feedback we've had, there's been high levels of satisfaction, both in patients and clinicians, in terms of working remotely. Obviously, it was keeping the workforce safe, but also in terms of patients, it was making sure they were safe, but were getting the care they needed. Clinical suitability, acceptability, we've learned a lot, but we've always felt that the benefits tended to be more in terms of the patients to start with. And it was, the saving that was there in terms of the travel time, the frustration of finding a place to park when you visit hospital and clinic appointments, which all of us have faced working in the hospital itself. It's quite difficult to find a place to park, honestly speaking. So in terms of clinicians, what was it for them if we wanted to make this sustainable and long term? There were a lot of myths prior to COVID in terms of we were not reaching out to people in rural parts of Wales. What about people with low income groups, disabilities, ethnic minority? And our data has shown and dispelled a lot of these myths, because again, we did a separate piece of work looking at the socio-demographics, and what we found was, the rural urban divide, 30% of our population was from low income groups. We had a good representation from ethnic minority. In fact, we had very good uptake from people with disability. When you think about it, not the need to travel and accessing care in the comfort of your home was definitely something that was going to stay in that particular group. But as we moved on, we realized that obviously there is more to it that can make it attractive, especially to the workforce. I'll share a little video that captures our journey other than me talking about what we did and how we did that.
In March 2020, our small video consultation project based in the CAMS team in Gwent became an integral part of planning for a national emergency. Working with patients had to change in order to keep people safe from coronavirus. As doors were closed, laptops were opened, and barriers that had been so rigid previously fell away. We had to move fast to share our knowledge and build on it. Early on, we had no idea of the scale of what was to come. Perhaps we'd be back in our old office in a month, we thought. Not quite. Those first few weeks went by in a blur, developing the team, writing resources, hosting training, speaking to patients, clinicians, politicians, and the media. Getting the message out there that support was available, we just needed people to adapt. And so many did. Video consulting, or VC, was quickly adopted across health boards, primary, secondary, and community care settings, urban and rural communities. Assumptions about who would and wouldn't use VC were challenged as we gathered the data and increased our understanding. From the outset, we collected data. We knew that hearing from as many people as possible would be key to learn how video consultations were being used, how it felt for patients and professionals, and crucially, how it could be improved. The scale of that work and what we have already learned has meant that video consulting is now a beacon, with people approaching us from across the world to learn more. Awards and accolades have come our way, and whilst welcome and appreciated, the most important accolade has been hearing from patients about the positive difference VC has made in their lives over this last year, how it has offered connection and support in a time of isolation and uncertainty. Resources, guidance and advice can be found on our website. Research papers and how-to guides are being written and updated all the time. So we must keep rolling this out across further specialities and settings to increase awareness and improve patient experience, no matter what the current circumstances in the world may be. A year on, and we can't stop now. There is still so much to do, so much to learn, and so much to share.
Obviously, there were benefits, and based on the 300,000 video consulting we've done, we've seen in terms of hours saved travel, both for clinician and patients, we're talking about hundreds and thousands of hours. We've been a very carbon friendly service, looking after our planet. On an average, 60 minutes are spent by a patient to access an NHS appointment. And, the place where I work, there's no direct public transport. So people often change 2 and 3 buses, which I'm sure a lot of you can identify. The cost implications, obviously, a lot of saving in that respect. But we know that, coming out of COVID, it's probably not going to be the same NHS that we had before that. So what can we do differently? And what is it going to make it sustainable, both from patient and clinician point of view? One of the main benefits that came for clinicians was the ability to work from home, although initially it was forced working from home. And we can all remember the days where we were trying to sort of find the best room in the house with the best Wi-Fi because everybody was at home stuck, homeschooling, adults, all people were struggling to get the right desk, the right height, chairs, and we saw people being creative with ironing boards and adjusting the level. But how do we go forward and what can be done differently? So that was one benefit that clinicians said would keep them attracted to doing this, but also in terms of recruitment and retention, which is a huge challenge, especially, in this part of the country. How can we make jobs more attractive so that people would want to continue working in Wales and be here? People have been even more creative in terms of thinking about the future because there are full-time virtual jobs being advertised and there are a couple of positions that have been filled as a result of that, which for years couldn't be. We're working with a trust in NHS England where they had consultant vacancy for 5 years and they've advertised for virtual jobs and they've had overwhelming response. So we know that there are pluses, but we also know there are challenges in terms of increased loneliness, people having increased rate of backaches, back problems, family disruption, people working ridiculous hours because there's often a lot of guilt when you're working from home. So how do we look after the workforce, but yet make sure that they enjoy what they're doing? So 2021, we advertised an all-Wales study to explore what are the pros and cons of working from home in more detail, working with Welsh Government, identifying what would the ideal working from home model look like. We were surprised in 2021, we had extremely good response to our call and we recruited 21 virtual focus groups to the extent that we even had to run virtual groups over the bank holiday weekend because people were so keen to be heard and wanted to share their stories. We had 138 NHS clinicians and non-clinical staff, and we also captured data via surveys from 400 people. So this was part 1 of our study, and Gemma will talk more in terms of the result. Part 2 was the peer-reviewed process, which we revisited, because again, what happened in 2021 was very different to what was happening beginning of 2022 when we were coming out of the pandemic. And then we conducted a thematic analysis looking at what the emerging themes were. I'll hand over to Gemma at this stage, who can tell you more about the findings.
Hi all. Yes, so here are findings from our part one of the study. So this was conducted with 21 we did virtual focus groups, and we had overwhelming a response to people coming forward, sharing all the pros, all the cons of working from home, but mainly to help us to develop what we wanted to understand would be an ideal working from home model for Wales. So 55.9% of our clinicians and non-clinicians were working blended at the time, so there was a mix, and 36% of them were working just remotely at the time. So this was back March 2021. But the preference to work from home was pretty high. It was almost 95% of respondents reported to be liking working from home. Next slide, please. So there were a huge amount of benefits from working from home. So like we said, when we were looking at the video consulting data, we were able to sort of see that patients had a huge amount of benefits for video consulting. The NHS service as a whole had lots of benefits, but benefits for the clinician seemed quite limited. It was travel savings and flexibility, but beyond that, there wasn't a huge amount. But when you looked at it from a working from home perspective, then lots more benefits came out from their own convenience, the flexibility to having less distractions. They reported to be able to be more productive. They had a much better improved work-life balance, and also obviously the travel and money spent on traveling was a huge benefit as well. However, like I said, there were dislikes. There was reduced social contact. People felt that that led into sort of being slightly less motivated, and also there was less clear boundaries around between working from home, as we all experienced trying to juggle the lot. So there was about 49.9 reported some negative impact upon working and 50% positive. So it was a very mixed bag of what was coming out. At the time when we were doing this, obviously this was like a year ago, and the dislike majority was around the lack of resources and the fact that there was such as no connection using the electronic record setup. But I think as conversations I've had a year later, these problems do seem to be diminishing slightly. Nice, next slide, please. So the suitability of working from home. So most of our respondents did report to have sufficient space in their home, so that spare room, or some reported to have knocked their downstairs toilets into an office. There was lots of people working it around. So in the majority said they felt that they had enough room to do it. So that didn't seem to be a major problem. However, there were some that reported to have lacked that space, especially at the time when homeschooling was part of the mix as well. However, like I said, some did make actual adjustments. There was some reported to actually moved at the time moved house to a bigger house because they knew working from home was what they wanted to do long term. So they committed to actually a house move, which I found quite impressive. And the access to resources. So most felt they did have sufficient technology to be able to do working from home. However, some again did have to reported that they put their own purchases against this, had to report that purchase their own laptops or their own desk chairs or things like that. And then when we asked questions around fulfilling work responsibilities, most felt that they could take on most of their clinical responsibilities, non-clinical responsibilities working from home. And some actually reported to be able to work more efficiently from home as well. However, again, like I said, there was a mixed bag, and some reported to be struggling, being able to fulfill that, and noted that some work wasn't able to be done, for example, some mental health appointments. Next slide, please. So there were some impacts of working from home. So a lot of data came out of early days that there was that sort of boundary of knowing when to take a break. Now I remember that back then you just worked a 12 hours straight through and didn't seem to stop and have a cup of tea. So that was those early day findings, and also was the fact that a lot of people, actually out of the 21 focus groups we did, all 21 focus groups reported this feeling of guilt that they felt that they worked from home, and this came out as quite an evident theme, that they kept saying they just felt guilty. They're working from home, so they should be working that much harder or that many more hours. But what was quite interesting is when we went back and spoke to them in the second phase, it was like they had learned to get over that sort of level of guilt and work around it, and conversations with their colleagues, realising everyone was feeling the same. And I think an awful lot of that has got a lot better. There were some physical health impacts reported. There was back pain, headaches, eye strain, that type of thing reported in those early days. But then there was other reports from a physical side that people said they were actually able to get out and do more exercise. And, you know, so whilst one physical thing was bad, the other one, it was like you were having a 50-50 bag all the time. Same with sleep patterns. Some reported to not be sleeping as well, whereas lots of other people were saying, actually, we're sleeping better because we're not getting up for a 6 a.m. commute. And same with diet. That was another thing. It was like some people were saying, we're stuck in the house, we're grazing all day, my laptop's right next to my fridge. Whereas other people were then saying, actually, no, we're cooking more home-cooked meals because we're at home. We're able to put the oven on and a stew on or an earlier time. So it was quite interesting to see these conversations because tips and hints were being shared, and it was interesting to see how different people were managing it. Next slide, please. The commute and travel, obviously we knew this was going to come out as lots of people reporting the savings to travel. But what was quite interesting was only 64.5% of them said they missed the commute. And I think there's a lot said for that commute. As awful as it is being stuck in traffic, you do use it to reflect on your day and to catch up and have some time out before you go home to your busy family. So it was quite interesting that whilst the travel itself was considered a benefit, the commute itself, there's more to the commute than just the travel, isn't there? And then the environmental benefits, that was, significantly, I think, everyone cares more about the environment these days than maybe even 10 years ago. And I think knowing that it's a bigger benefit beyond your own personal self. So we asked them about this ideal model that we wanted, and that blended approach was the majority of what people wanted. It was quite interesting. Like I said, that 50-50 bag has a lot to say. Nobody really liked the idea of being 100% stuck at home, but nobody really liked the idea of 100% going back to the office, really. It would be nice to have a nice mix, a blended and being able to work around, but also the importance of choice and the desire to increase choice and flexibility that suited you, your job and your home and work-life balance as well. So it was ensuring that choice sat with yourselves as well. Next slide, please. So at the end of part one, we asked them to help us design this ideal model. And originally 15 recommendations came out of all the findings. And this was to produce an ideal working model consisting of these 15 recommendations, which was an all-Wales blended approach. So regardless of whether it was a clinical or non-clinical position, there was to offer this both remote and office-based working to all employees, regardless of what their job was. Access to a suitable setup for all staff to avoid these physical risks. So in the sense that, office chairs were made available rather than having to be a cost to themselves. Communication of clear expectation was considered a must to ensure that people were able to work towards their goals, but also the essential element around making sure they took breaks and that issue around guilt that I'd mentioned. But also there was some call for conducting regular risk assessments between staff and line managers, and wellbeing issues were addressed as well. And then some services suggested that they should be organised regular meetings and social events, such as celebrating staff milestones, maintaining working relationships and increasing professional support. And at the time when we first looked at these recommendations, there was mainly suggestion for this sort of top-down approach. However, when we went back to part two of this study, recommendations changed significantly. So what we did is we put all these 15 recommendations out to the audience and asked them to come back and feedback on what they believe these recommendations, actually, if they were correct to what they originally put forward. So next slide, please. So what we did is we sent out all the recommendations and we asked them to agree if they believed yes, no, maybe, and then to provide additional feedback. So this went back out then to 465 NHS and social care staff, but also this time it went out to education, it went out to Welsh Government workers, a much wider audience, university staff, and we wanted to know if these recommendations did actually sit in what this ideal model they believed would suit their job. As you can see, some of them were very high. So it was like the first recommendation was, you know, the blended approach, whereas as you work down to sort of areas like to celebrate milestones, interestingly, that wasn't wanted anymore. Some people were saying, actually, no, we don't want to socialise. You know, that was a 50. So it was interesting to put the recommendations back out to them. So once I finish the presentation, I'll share the full report for you to sort of see exactly what these recommendations were and how they scored against themselves. So it was quite interesting to put it back out as that peer review to give it that second line of attack as well. Next slide, please. So in the end, 7 recommendations were proposed. So we took on all the feedback that was sent and reworded the recommendations. So the recommendations now sit as an all Wales blended approach still, and it would be available as an option to all employees if they wanted it. So recommendation 1 was, in appropriate circumstances, the choice of remote working should be at the discretion of the health boards, trust and managers, supported by the professional bodies, occupational health and employee unions. Whilst managerial discretion is a factor, the decision to work remotely ultimately should be based upon individual employees' circumstances and the nature of their job role. Recommendation 2 was the offer of appropriate equipment to support, you know, a proper setup for all to be able to work from home safely. However, it was suggested that this shouldn't be mandatory. Recommendation 3 was the improvement of IT infrastructure. As we all know, the Wi-Fi and, you know, all setup isn't wonderful across Wales, but also there was a push that for needing things like printing subscriptions maybe should be part of it, or also upgraded software and platforms as well. So this is something the Welsh Government are working towards, and obviously Tech Cymru are a big part of that. Recommendation 4 was the offer of professional development assessment should be considered on ad hoc basis. So back in the first phase of the study, it was suggested that they should be run. However, as this went back, it was suggested actually they should be done ad hoc, and rather than, because it would just add the additional pressure. But also the importance of defining expectations. And I think, you know, we all sort of went into this as an emergency, but going forward, it needs to be a bit more structured. Next slide, please. And recommendation 5, so different individuals want different things from working relationships. And like I said, that social element of meetings wasn't for everybody, and I think that needs to be taken into consideration. And recommendation 6 was making sure we're looking after the mental health and the well-being of employees, and this should be a priority. And then the final recommendation was ensure that we tackle the loneliness and social exclusion of working from home. So these were the recommendations put forward. We've also developed an infographic. So what I'll do at the end is I'll share all these links with you. And this infographic was done back early COVID, when you could receive tax relief for working from home, but that seems to have been cancelled ever since. So, but it's a very nice. We worked with a mental health team and a spinal surgeon team and developed this infographic of working from home in the safest way with some nice hints and tips. So I'll share this with you at the end. Next slide, please. So the revised set of recommendations are going to be planned to be shared with a much wider range of different organisations, such as unions and health boards, and it's now been submitted to the Welsh Government, and we're working now with all policy leads in the Welsh Government to ensure these recommendations are now properly embedded. We do plan, though, as we are really keen to always evaluate in Tech Cymru, is consistently every 6 months be touching base on this working from home. So we don't want to just do this study and assume that we know all the answers, because we most certainly don't. So this is something we're constantly analysing and constantly, you know, speaking to staff and finding out how things are changing, if any of these improvements have been made and why not. So we plan on always going back to the drawing board on this. So that's all from me. I know Lauren is putting a Mentimeter up for a question for you all. So and that's all. Thank you.
I'll just pop that Mentimeter up for you now, Gemma. Bear with me 2 seconds.
Thank you.
If you haven't used Mentimeter before, it's an anonymous interactive questionnaire tool. We've only got one question. You can either use your desktop or your phone. So if you've got that handy, please could you go to menti.com and enter in the code, or you can scan the QR code on the right, and Abby will be popping a link in the chat bar too for you to access it that way.
I've also popped the infographic and the reports in the chat as well, if anyone's interested in seeing them in full.
Okay, you just let me know when you're ready for me to take it down, Gemma, and then I'll hand it back to you.
Yeah, I'm happy for you to come down now. That's fine.
Perfect. Thank you.
Thanks very much. Yep, so that's all from me, and we're open to any questions if anyone has anything to ask us.
Do you know, it's typical. I did have a question and it's gone out of my head. Isn't that dreadful? Wonderful session, ladies. I think that's really exciting, and it's interesting to see that, you know, people do feel that a blended way of working is really helpful. It's so challenging, isn't it, when some things work for some people and some things work for others. I guess in a long-winded way, I'm kind of getting there, letting my brain catch up with my hand. Is there something about almost like some tips and guides for helping people navigate that blended approach? You know, is there something that we can do to try and, you know, some people are naturally creative with their ideas, and like you say, some people spontaneously went out there and changed the configuration of their home. But I guess, is there something that we have already, or is there something that maybe we need to consider that would help those folk that are struggling for some inspiration to help them with overcoming some of the difficulties with home working?
Well, there's nothing available at the moment, and I think this is discussions we're having with the Welsh Government, is making sure that the Welsh Government are well aware that there's two different types of, you know, people who do want it, don't want it, and I think there has been, like, we've started developing some infographics with some guides, but I think the call for more information and more resources is something we have put towards the Welsh Government. So hopefully, eventually something will be, but this is something we're quite keen to not just hand over to the Welsh Government and walk away from. We're staying as part of it and keeping asking the same questions to the workforce. You know, is there anything else you need, so we can keep going back? And so that's where our roles is sitting. But definitely is a need for it. But nothing that I know of, unless somebody else does, but nothing that I know of is available right now. So.
Okay, so if people have got ideas about some of the things that they would recommend or could go into a pot to inform such a resource, would you be happy for me to put the shared email address up so that, you know, perhaps we could, or would you prefer that they come to you directly, Gemma? Is that the easiest way?
Yes, certainly. We're always open to being creative and working with lots of new people. So yes, please.
Lovely. There we go. So if there's any ideas about how we can do things, then perhaps we can get those ideas through to Gemma. So I'm just noticing Sarah's added a question in the chat bar about, you know, will you only work with Teams for video conferencing in the future, video consultation in the future, do you think? And Alka, you've put a response there. Would you like to expand on that?
Yeah, again, when we started, obviously, Attend Anywhere was a platform that was being used in Arran Bevan. There was a project that was up running by Welsh Government, and we were familiar. It went through all the checks in terms of information governance, and that was recommended for delivery of healthcare across Wales. So we stuck with a single platform, compared to NHS England, where they were using multiple platforms, Zoom, Skype, Teams, WhatsApp, because one thing we wanted to make sure was that safety was not compromised. So, you know, there are huge concerns, which we knew, again, within the context of COVID, people hacking into the system, you know, cybersecurity risks, which again, I had red alerts. So at the moment, we're going through an option appraisal, we're going through procurement, and we're looking at everything that is in the mix, because a lot has changed since we started 2 years ago. We still do recommend that we continue using Attend Anywhere as for now, because it's gone through all the safety checks. Teams is something that's used for professional meetings, and it's fine, but, you know, there are some certain things in Teams which probably, if you use for a patient appointment, you know, your email comes up, your name comes up, there are ways around that, but it gets a bit clunky. So that's the position as of now, but who knows, maybe 6 months later, we'll be having a totally different conversation. So that's up for discussion at the moment.
Brilliant. Thank you, Alka. Another quick question for you, Gemma. You've put some links to those resources in the chat bar for us. Are you happy for us to put those with the rest of the resources on the AHP webpage, just so that anybody that does come back and look at the recordings retrospectively, they'll be able to access those? Also, yes. Brilliant, thank you. Also, we've been placing the Mentimeter link or any of the interactive sessions on that same web page, so that if folk are coming back and watching their sessions back, then they can still participate in some of those interactive activities. So we'll put all of those up, and the link to the page where all of that information is in the chat bar. Brilliant. So thank you so much for your presentation, ladies. I think that's really stimulated some interesting thinking. So it's my absolute pleasure now to invite Adrian. Would you like to present your session?
Thanks, Wendy. Yep, I'm going to share my slides. And I can only see you, Wendy. Is that okay? Slides are up?
Yeah, slides are up.
Excellent. Hi, everybody. My name is Adrian Neal. I'm Head of Employee Wellbeing for Aaron Bevan. So you've got me rather until past. Also aware this is being videoed, so it's a kind of blended resource, really. I'm really happy to take questions as and when you want to ask them, or wait to the end. Wendy's going to keep an eye on the chat bar, so if you want to put questions in there, then Wendy can prompt me. Fab. Yeah, so let's be flexible, but really happy to be more interactive if you want, or I can just bore you to death with talking to you. But either way works. Right. So we are going to be looking, I guess, the working differently theme, but looking at looking after yourself at work. When I first saw this, I winced slightly because I thought, what can I add to this? Obviously, a lot of people are aware that well-being and sustainability is fairly important. It's getting a lot more press, but also it's quite divisive in many ways, because it tends to split discussions around mental health versus health versus ill health. It tends to focus on the individual. And we also know that that's fine to a point, but we also know that a lot of us work in environments that are often not very good for us. Just speaking bluntly, a lot of our work causes us problems. So actually, when you start to look after yourself, you're immediately facing a bit of a paradox there, thinking, well, if I looked after myself amazingly, which I don't actually know what that means, and my work was a constant source of distress and stress, what am I actually doing? Am I just going around in circles? So my natural inclination is to follow the evidence and just to be bold in, I guess, stating that. And that may well challenge some existing narratives, which is absolutely fine. But I just wanted to walk you through an evidence-based model which I use regularly within AB, just to help you think maybe slightly differently about looking after yourself at work. If you've heard me talk before about this, then a bit of a consolidation of the model will be absolutely fine. If it's new, brilliant. At the very least, you'll be exposed to something that perhaps is slightly different. So I'm going to crack on. So we all know that we're pretty much flooded with good advice about looking after yourself. It's there's a whole industry out there telling us what we should and shouldn't do, and it often changes daily. Some of it is based on really sound research, some of it is just kind of urban myth, but I won't read these out. But in many ways these aren't actually wrong, but in themselves, by themselves, they're often pointless in many ways. So be kind to yourself. Let's just talk about that. As a sentiment, fantastic. But what does it actually mean? How does it look like? And how do you do it? Particularly for a workforce that is focused on the easing distress and pain for others. How do we do that to ourselves? So some of these things seem very simple, but are actually very hard to do. And delivered at the wrong time, this message can actually cause problems. So, the idea of telling somebody to kind of suck it up, that stoical approach to coping may well work for one person, but for another person, it may just be the straw that breaks the camel's back. So again, we are socially attuned to each other's distress. We all have learned ways of managing. but we very rarely look at an evidence base to actually think about looking after ourselves and our colleagues in the workplace. So that's my controversial start. I'm just waiting for the questions to start coming in. Nothing so far. Okay, so what do we really need? Obviously, coming from a position of seeing a lot of need, what we need is an idea of one, I guess, to understand what we need. And this is again sounding slightly tautological. If we don't know what we need, how do we know what we need? But do we understand our own needs? Okay, most people will, when you talk about needs, will kind of dredge up some learning around Maslow's hierarchy of needs, which is an absolutely fine beginning place. But actually, if you look at it as a piece of evidence, it's massively flawed and hugely outdated, and also not really, I think, fit for the NHS. So we often have assumptions based on outdated models, or on very personally biased anecdotes and things that work for us. So again, it really is helpful to stop and pause and think, so what do we actually need from our work? So if we're going to ask that question, we need to think broadly. We need to think specifically about our working environment, not our whole life. Now, the challenge there is for the NHS, or people working in the NHS, is their work is very much part of their whole life. It threads through their identity. It often dominates their attention. We struggle to leave things at work because we're emotionally driven very often, and it's so much easier to say split the life work balance, but actually that very rarely, in my experience, works. And certainly over the last couple of years, we've really, the blend between work and life has become extremely interesting. And we're then picking up on the previous slides, the previous talk. When you're working at home, that becomes even trickier. We need to work out what are we trying to look ourselves, what's our objective in looking after ourselves? Is it because we want to thrive? We want to have this ideal experience of work, and that's where we're aiming? Or is it just we want to keep our head above water? We've got to actually work out what is looking after ourselves. What's the purpose? What's the point of that thing for us as individuals? Because it will differ. If you, well, I'm sure you and your colleagues will be thinking quite differently about what they want from work, having made it through the pandemic, and will be looking to the next, how many years, with those questions very close to your heart. And I think it's important to really understand what is it, what do you want from your work? I guess we can also draw upon evidence, because even though we like to think of ourselves as individualistic, we are relatively predictable, and that, I guess, that keeps me in a job. But it also helps us navigate some of the bigger questions. What are these needs? So if you're looking for a kind of a visual summary of how to look after yourself at work, you've got to hold three key kind of factors in mind, three key cogs. So one is, what do I need from my work? What does it give me? What do I need from it? So psychologically, emotionally, financially, what is that? Have I ever stopped to ask myself, why am I doing this? Why do I want to continue doing this? We need to then look at, what are the demands of that work? What does it ask you day in, day out? Has that changed? Do you know what it's asking of you? And then we ask ourselves, what resources might I need to help me keep that balance? So it's a kind of three-way process of trying to keep a sense of balance. But it is a little bit like the Holy Grail. But it starts with asking yourself, what do you need from your work? So the evidence will tell us there's a well-evidenced, I guess, list of ingredients that we all need to some level. Now, what I tend to say to people is that, well, we know the ingredients, but each of you have a slightly separate recipe, but you need to know it yourself. So if we're in the Great British Bake Off season, I'll be using baking metaphors. We're not, I don't think, but we can use that. So each of you have to take these ingredients and determine at which level, which one are more important to you, what flavors do you prefer to kind of put together, what works for you at this point in your career. We know people need to feel safe, and that's safe from physical and psychological harm. Now, the dilemma then is, do we know what makes us feel unsafe? You know, our brain is wired to detect threat. Do we understand what that means for us? What makes us feel threatened? Again, huge amount of idiosyncrasy around this factor, but without that central component, everything else starts to wobble. We need to have a strong relationship with our work, with our colleagues, with our organization, but it has to fit our sense of what's important. So that sense of belonging, which has been truly battered, I think, for many during the pandemic, we have to get that right. We have to know what we want from that at this point in our lives. We have to anchor our purpose. We have to hold it close, and we have to keep checking in to see we are aligned to that purpose. If you miss it, you will know, because you'll start to feel demoralized. You'll start to feel disengaged from your work. The NHS, in my experience, is absolutely filled with people who want to make a difference. By and large, you know, we're not here for the money. We have a sense of collectively contributing to some greater purpose. But when was the last time you checked in with yourself to ask what that is? And does it need updating? Is it possible? Are you happy with that shared purpose? And does your job align with that? So these are really important things. The job has to give you more pleasure than pain. By and large, we're not masochists, so we need to have pleasure, and whatever that means to you, you need to be clear, but it has to activate your sense of enjoyment and joy more than distress. Now, it's very rarely 100% pleasure, but it has to certainly give you more good stuff than negative stuff. You have to feel valued. You have to have a sense that you are effective. Again, you lose that, you lose direction. We're very sensitive to organizational fairness and justice, so you have to feel like you are being fairly treated, and there is equity of availability to resources in how people treat each other. So there's that very, very sensitive lens we look through. And we have to have a sense of agency, of control over our world and our work. Now, this varies from person to person, but is incredibly important. And you'll know if you're losing a sense of control, because you'll probably start to develop behaviors that you may not appreciate are designed to get you back in control. You know, copious list making, anxiety about planning, things like that may be an indication that you're feeling like your sense of agency is slipping. So these are the ingredients, and you could break these down into subgroups, but essentially this is the stuff to draw upon. So if you then move on to, oops, there we go. Do we understand the demands of our work? A simple answer would be, of course, because we work, it's our work. The problem is actually it's far more subtle than we often appreciate. The physical demands are often the easiest to see, because by nature they're physical, but we often overlook the psychological, the social, and what we generally call the mental, the cognitive. So very simply, if we use this model, so the job demand resource model, we'll say, okay, so most of this stuff is not in your job description. Most of this stuff will be part of your work and will fluctuate. The physical stuff you can probably identify and mitigate. So physical demands tend to be mitigated by physical resources. So let's say if your job involves a lot of driving, a lot of physical lifting, well, There are ergonomic assessments, there are tools that you could access, and indeed there's a whole raft of legislation saying that if you don't have that supported, your employer can be prosecuted. So that makes it slightly easier to authorize acknowledgement of the physical demands of your work. But the psychological and the social and the cognitive are very, very rarely overtly referenced in job descriptions or measured. So by psychological, I mean the psychological impact of your exposure to things. And if you're clinically facing, you'll know what that means. But it's also the psychological tasks and demands that you will be required to do to manage your own emotions in the context of distressing work or just work. It's things like psychological labor, psychological load, the need for you to kind of balance the complex emotional tasks of your work are very rarely cited in job descriptions in detail, which will help you understand what you might need to help you with that. The social demands, we're a social animal, but we all have slightly different social needs. But engaging with people is actually quite demanding. You will know after a busy day of speaking to people, you will be exhausted, but you may not have left your desk. You may have spoken to people via Teams, which requires a fairly predictable level of physical demand, but will it be exhausting because you've had to concentrate, a mental or cognitive demand. But you'll also have to be empathic. You have to try to engage them. All of these things place additional incremental demands on us, which are frequently unacknowledged. So this is, I guess, the idea is if you can walk through your work and work out which of these demands you may not recognize or which of them are unacknowledged, you can then perhaps start to look at what resources you might need. So if you think again about that 4 or that 3 cog model, the resources ideally should be there to help you offset the demands. It's as simple as that. The trick is to match them. So the simplest ones I've talked about is physical demands. Easy to see, easy to measure, easy in many ways to mitigate. Trickier ones, more complex demands, often the demands associated with working with people, humans, we're a tricky species, but particularly humans in distress. That itself can create a huge amount of unforeseen and unrecognized demand, which is on top of everything else. And when we're looking at resources, we have to look at 2 types of resources. One is the resource which we'd consider internal resources, so you. So what you bring is you, your personality, your idiosyncrasies, the psychological architecture of you, which you very often will just, you will not, I guess, be trained to understand how that will then interact with your clinical work. It just happens. But some people, people are built differently. So some people are very able to tolerate risk. Some people are very good at impulse control. Some people are very good at kind of sitting with the distress of others. But these are things that we very rarely, unless you are specifically trained to look at these things, you just end up doing them or not. And you find another way to manage these psychosocial resources. So an example, there are 2 distinct ways which people tend to cope with things that are distressing. So you have people that are integrators. They step towards the distress. They want to know more. They want to touch it, to smell it, to process it. And they're the sealers-overs who prefer to kind of put it in a drawer and kind of move away from it. Neither's right or wrong, but both of them will have consequences if they are overused. So again, another example where it might even be really helpful to know what kind of coping style you have, because then you could, potentially seek support or education or training or other resources to mitigate that. So again, once you understand the demand and you understand your position in relation to that demand, you're in a much stronger position to understand what resources you might need. And the general rule is that the demand mirrors the resource. So if it's a psychosocial demand, then a psychosocial resource is generally required. There are variations to that rule of thumb. But who of us have had opportunities to, I guess, sit and process some of the experiences we've had over the last 2 years? We're increasingly recognizing that that's helpful, but why? What does it do? Why do we need that? Does everyone need it? So again, these are important questions that we need to think about for our own resources. What happens is, if the balance is wrong, what we tend to only notice is the physiological or psychological symptoms which bubble up after a kind of prolonged period of this stuff growing. And what we're looking at is essentially physical and emotional exhaustion. We're looking at chronic stress. We're looking at disengagement and a kind of fractured relationship with your work and your employer. Looking at disillusionment. So all of these things are, in my eyes, the end product of getting the balance wrong. But who helps us understand the balance? So I guess my position is, and this is my final slide, is this is the mechanism. If we understand this for ourselves, we can help our colleagues. If we're in positions of leadership or management, if we understand this basic mechanism, I say basic, it is basic, but actually it's fundamentally extremely complicated to enact. We're in a much better position to look after ourselves, but also to help guide and support those around us, because we technically can't fix anyone else, but we can help give them a much clearer sense of what could be helpful. And it might also be helpful for when you do engage with colleagues or even yourself and you know you're in that kind of red zone, you can potentially hit the pause button and look back and try and work out how you got here. And that in its own right can be extremely helpful in then changing what's going on next, rather than simply walking away or deciding that this is not a tolerable situation anymore. You can engineer a potential solution, which to me is always the preferred outcome. But you never know what you might need at that point. So that's the last slide. I am going to come out of slideshow and see if we've got any questions.
There's no at the moment in the chat
Stunned silence.
But I've got a question for you, Adrian.
Sure.
A lot of what you've said's really resonated, because I think sometimes we fall into that trap of trying to think about what the solution is before we actually understand what the problem is. And this is that same age-old issue, isn't it, of we really truly need to understand what's going on for you before you understand what you can do to help yourself. So I guess my question is, not everybody is able to see the wood for the trees when they're doing that kind of self-reflection, isn't it? So when you're trying to think about the things that you want or you don't want, it's helpful to have, a supportive but sometimes quite critical friend that asks you those really hard questions. If people find themselves in that sort of a position, where's the best place first to signpost them? Because that puts you in quite a vulnerable state, doesn't it? So you're not always going to want to do that with a line manager or a colleague. Where would be the best place that people could look for that kind of guidance and support?
Don't know. I guess that those kind of resources differ from health board to health board. I guess I would actually step back one and say, in many ways that the evidence suggests that the biggest predictor of individual resilience, so a popular word but a really complicated concept, is not their own set of resources, but actually their social resources. So I guess if you find yourself in a position where you cannot confide in a colleague or a manager, then already there are problems. And I guess I do see this quite a bit, and it's a kind of perennial dilemma, because what then people do is then they seek help individually, which is perfectly credible and great if the resource is there. But already it highlights a bit of a problem in the system within which they're working, in that they may be isolated, they may not feel safe. And to me, that's the red flag in its own right. So while I'm keen to encourage people to ask support, what I'm saying is, if you find yourself in a position where you can't speak to anyone that is not in a tertiary service, let's say, there's something wrong with your system already, because it means you feel vulnerable and you are not supported at that level. Now, if you think of the approach to well-being, the most useful one I've come across is just a simple triangle. So 3 levels. At the top, you've got your tertiary services, so a bit like my service, self-referral service, technically psychological therapy, and that's an area of variable clarity, but it's people seeking private or confidential help, which is fine. But as you go down, you're looking at actually the resources people need often tend to be much closer to the shop floor. And the middle level, you've got team coherence, well-being factors around satisfaction, control, being able to feel like you could make a difference, time. And at the bottom, you've got core resources like, do I have the right environment to work in? Is my job description clear? Do I know what I'm doing? So once you find people going to the top, it's already a problem in a way. So a very long-winded answer to avoid answering you, Wendy. But does that make sense?
Yeah, it does actually. It does, and I guess it does highlight the importance of trying to take a moment and have those thoughts and feelings, because would I be right in thinking that if somebody is noticing that they're not feeling necessarily psychologically safe, or they are feeling vulnerable in their workplace, there is a chance that perhaps peers and colleagues may also be feeling the same sort of thing. So, perhaps there's a conversation to have. And we're saved at the moment, Adrian, by Sarah, who has posed a question, and she asks, have you experienced more people seeking support for anxiety during the pandemic?
I would say we've certainly seen an increase in people seeking support for distress. And I'm being evasive there, because what I try not to do is I guess compartmentalize depression, anxiety, kind of mental health conditions until I know that is what the problem is. And so we definitely see an increase in people who are distressed, but it's kind of, and anxiety is one of the most common emotions we have, and it's not good or bad, it's just there. But yes, that there is definitely a lot more anxiety out there. But what you also have is it's often muddied with other things, like a loss of control, or an uncertainty about the future, or just a sense of, well, what's the point of me working anymore if I'm just treading, it's usually blended with other things. But as a cold number, we've definitely seen, over the pandemic, probably our referral rates have doubled, with people seeking support as individuals that are distressed. Just to put that into some context, the referrals for teams seeking support has actually grown by even more. So there's a lot of people that are unsettled and uncomfortable and distressed out there, but I would say that they're not all at diagnostic levels, which is thankful, but it doesn't mean it's any less significant.
So that leads us on quite nicely to the last question that's been posted, and I think possibly the last question for the session. So if anybody does have any more questions, please feel free to email those through. But I guess there's a question around whether the pandemic has actually helped the NHS in general and health boards to become more empathetic towards staff wellbeing, or does it depend on those individual personalities or qualities of the managers? And I guess, has there been that shift organisationally?
It's hard to speak beyond AB, but I can speak I certainly have a lot of colleagues that I'm in touch with in NHS England. I guess the focus and awareness on employee well-being has never been greater. That's true. But we also had problems before the pandemic, and we were trying to flag these things. So I think there is a greater awareness. Now the challenge will be how that, so the kind of so what question, what does that mean on the ground? So to me, the proof in the pudding is really in the delivery and support for resources and a kind of strategic approach to changing the problems. And I do know that the problems don't just exist in individuals. So I would say that the more an organization invests in, I would say, quite radical systemic approaches to this, and views it as a systemic issue as much as an individual issue, the more it's taking it seriously. And we know that with competing demands, with the politics of the NHS, with its kind of interesting amnesiac memory for problems, because of the demand and the anxiety to deliver, things can get lost very quickly. My fear is that we move on, public's forgotten, soon we're just back to normal, and we have not had an opportunity to recover because no one's actually defined what that means. So I'm on the fence there a little bit. I think great opportunity. I'm getting a lot of support within AB. Our exec team is absolutely kind of key. It's how the organization will hold that, not knowing what to do, but knowing it's an important area, and will be willing to do something different. So another slightly long-winded answer, so sorry.
No, that's fine. Thank you very much. I'd like to thank you so much for your session. There's been comments in the chat bar saying how helpful people have found this. There was one last question around the impact of the war in Ukraine at the moment, and how difficult it is for managers to support teams going through that uncertainty. I've placed a link to an absolute wealth of health and wellbeing resources that I know that the Wellbeing Network has collated. There's the conversation guide, having how to hold a wellbeing conversation. So there's a raft of resources online. If you haven't had a chance to look at them, then perhaps that can help to point you in the right direction. So I guess it leaves me to say thank you so much, Adrian. And unfortunately, I think Alka and Gemma have had to leave us already. So what a wonderful session, and we really appreciate you taking the time to talk to us today. So thank you.
My pleasure.